Hi everyone and welcome to DrLogic360, where your health becomes simpler and smarter. I am Dr. Joseph Gnanaraj and today we will talk about something that often looks scary but is usually harmless with some exceptions. That is syncope or fainting. Have you ever felt your head spinning, vision going gray and tunnel, and suddenly, boom, you wake up on the floor wondering what just happened? Don't worry, you are not alone. In this video, I will explain why people faint, when it is safe, when it is serious, and most importantly, how we can prevent it. All in simple, practical terms. Syncope is just a medical term for fainting or passing out. It happens when your brain does not get enough blood and your body decides to take an unscheduled power nap on the floor. You wake up quickly, maybe confused or tired after having a fainting episode. It is your brain's short power outage, but usually it is temporary. The most common type of syncope is vasovagal syncope. It is simply an exaggerated normal reflex. So what is a reflex? Reflex is a protective mechanism usually. For example, when you keep your hand on a hot surface, you tend to withdraw your hand suddenly from that surface, protecting your hand from being burnt. Similarly, when a person is standing for a long period of time or in pain or in fear, what happens is the heart rate goes up. So whenever the heart rate goes up, the brain thinks there is something going on with this person. And the brain wants to reduce the heart rate by stimulating the vagus nerve. Sometimes this reflex gets exaggerated and the heart rate drops very, very low and the blood pressure also drops lower. So when the blood pressure and the heart rate drops, the person does not get enough blood supply to the brain, resulting in the syncope or the fainting episode. Usually this vasovagal syncope is preceded by warning symptoms such as lightheadedness, dizziness, and then your vision could become tunneled and gray, and you can experience increased sweating and sometimes nauseated and vomiting. And people around you may notice that you have become very pale before you passed out. So usually, as I said, it occurs in stressful situations such as after standing for a long period of time, or when you are in pain, or when you see blood, or when you are about to give blood, or when you are about to give a blood test. The vasovagal syncope can happen around that. So when you feel these symptoms, it's time to lie down or sit down immediately to prevent you from passing out. So what are the other things which you could do to minimize these episodes or prevent you from having these episodes? So keep yourself hydrated. Consume a lot of salty foods and keep a packet of pretzels or chips always with you, so that you snack on them very frequently. And the other thing which you could do and is very effective is the compression stockings, particularly thigh-high compression stockings. So the idea here is to prevent the pooling of blood in your legs when you're standing for a long period of time and to pump the blood back to your brain. And also, you could keep your legs crossed when you're standing for a long period of time to prevent the passing episodes. Similarly, you could also squeeze your thigh muscles and buttocks muscles in a rhythmic fashion will improve the blood flow from the lower extremities towards your brain, thereby preventing you from passing out. Also, you could wear girdles in your abdomen to prevent the pooling of blood in the lower part of your body. So this should be done along with the thigh-high compression stockings to prevent syncopal episodes or fainting episodes. So next, we are going to talk about some of the dangerous causes of syncope, such as cardiac syncope. This cardiac syncope is usually sudden onset without any warning symptoms. It could be associated with exertion sometimes, or it could even happen when the patient is lying down in the bed without any warning. And sometimes it could be accompanied by chest discomfort or palpitations or shortness of breath. When you experience these kind of symptoms along with palpitation, it's time to seek medical attention or 911 immediately. The next common cause of syncope is orthostatic hypotension. The term orthostatic hypotension means that your blood pressure does not rise appropriately when you go up from sitting to standing position, or when you are standing for a long period of time, you drop your blood pressure so that the brain does not get enough blood flow to the brain. This orthostatic hypotension is very common in elderly patients, particularly beyond the age of 60 years. It could happen from dehydration, or it could happen from some medications. Sometimes it could also happen because of certain diseases causing autonomic neuropathy, which is the dysfunction of your autonomic nervous system because of certain diseases such as diabetes and Parkinson's disease. In this condition, what happens is in the upright posture, the patient's blood pressure is lower and the patient does not get enough blood flow to the brain, and then they pass out. Some patients can pass out in certain situations, such as with intractable cough or when they are peeing. They can pass out because of the increase in the pressures inside their chest, which in turn will decrease the blood flow to the brain and make people pass out. These are called situational syncope. In summary, most syncopal or fainting episodes are benign. So next time when you see a patient who has passed out, don't panic, but raise their legs immediately and make sure they are not injured from the fall. Don't make them stand right away. Check their breathing, pulse, and call for help. It's often your body's way of saying, I need a moment to recharge. But if they pass out suddenly without any warning symptoms, and if they have any heart associated symptoms like chest pain or shortness of breath or palpitations, or if it happened with exertion or when they are lying in the bed, it's time to seek medical attention or call 911 right away. Thanks for joining me, and this is Dr. Joseph for DrLogic360, where your health becomes simpler and smarter.